actually dates back probably 20 years ago when American Hospital Association and several other regulatory agencies determined that we should treat pain as a vital sign and make it go away. That was not very realistic, and the effort nationwide to chase that goal led to ever escalating doses of pain medicine that we now recognize as unrealistic and dangerous. And for the last 5 to 7 years, I would say, healthcare and physicians in particular have gone out of the way to reverse that trend, and it's been reflected in the statistics for a gradual reduction in the illness, the morbidity, and the mortality, the deaths that can be attributed to prescription pain medicines. So a lot of what I do is intended to try to manage pain in ways that do not depend on the hazardous opioid pain medications at high doses. Do I avoid them entirely? No, because there are some conditions for which alternative treatments don't work, and we do have to rely on something in the way of medication for pain. Unfortunately, there is not a lot of medications that are more effective for reducing pain than opioids. We try to stick to low dose and short usage, but we do tend to incorporate that in our treatment.
When we get back from our break in a minute, we'll talk about the new government regulations, because I think it's important that people understand that government regulations that limit our use in prescribing medicine is actually a very intelligent paradigm for us to live within, so that we don't create as many addicted patients. It's easy to become addicted with medicines. I've had patients become narcotic addicted who've never had a history of it before. A little old lady falls down and breaks her hip. I give her, just in her 3 days in the hospital, that she becomes addicted for her first exposure ever to a narcotic. There's an innate ability for some physiologies within certain people. Once they get exposed to narcotics, they can very rapidly develop a chemical need for that medication. And so out of respect for that, we have to have our ears to the ground, we have to be on the lookout for it, and we have to be able to respond very rapidly so that we reverse that tendency. Because there are ways of controlling pain in the acutely injured person, and certainly in the chronically injured person, where we don't give just narcotics for pain control. The concept of pain management is so much more than throwing a pill at it so that they become stuporous and they don't pay attention to their pain. That's not modern pain control.